Let's turn to vaccines. We've been working with the federal government on this. I had a conversation a couple hours ago with the vice president about this, and we continue to learn more, and this continues to be fine-tuned, and this will be a work in progress. This is not something that we're going to set it and it's just going to go. It's going to be continued to be fine-tuned. But let me repeat what the main objectives are. I think these are the same objectives we have as the federal government has, and I think it's the kind of universal objectives. One is to save lives, to cover the most vulnerable people as quickly as we can, people who are in a situation where they're more likely to get it, and if they do get it, or more likely not to have good outcomes. The second is to slow the spread of the virus. And third objective, one more certainly, is to make sure that our healthcare workers, those people who are on the front line, risking their lives, and those people who we rely on, not just for help with COVID patients, but with others, that they are able to do their jobs and that we can do everything that we can to keep them safe. So as we look at the objectives, we'll be starting, we hope, the middle of this month in phase 1A. The priorities that we have set are consistent with the priorities that have been given by the CDC. And I want to go through these in just a general description. There may certainly be different groups that have been left out, but I'm trying to give you all an understanding of how this is going to work. As we begin phase 1 of the vaccine distribution, we hope that is around December 15th. The following are the priorities. And these are priorities not in order. They're all the priorities that we will be working to get the vaccine out to just as quickly as we can. Healthcare workers and personnel who are involved in the care of COVID-19 patients. Read again, healthcare workers and personnel who are involved in the care of COVID-19 patients. EMS responders. It's the second group. Then we come to a series that I'm going to read to you of different groups, but they really all come under this definition, and that is that we will prioritize vulnerable individuals who live together in close proximity and those who care for them. Vulnerable individuals who live together in close proximity and those who care for them. These are the ones that we have found. These are the ones who we have found to be the most vulnerable. This would include residents and staff at nursing homes, residents and staff at assisted living facilities, patients and staff at state psychiatric hospitals, people with intellectual disabilities and those with mental illness who live in group homes or centers and staff at those locations, residents and staff at our 2 homes for Ohio veterans. So these would be examples of individuals who will be in Group 1A. Now, we are still waiting for confirmation, firm confirmation about what will be sent out in the month of December. So we can give you what we believe these numbers are. And I will tell you what has been confirmed and what has not been confirmed. But the federal government has made clear that we will not know for sure what these numbers are until we are notified in that week. A few days before we get them, we will get a number. and we will know that those are in fact coming. It is our understanding, again, this is subject to change, subject to shipment, and we're just trying to provide people of Ohio the best information we can at this point. It is subject to change. Pfizer, on or about, if this is approved, if this is all approved, we would anticipate around December 15th, there will be a shipment that comes out. On that shipment, 9,750 will go to our hospitals. This will be the vaccine that's pre-positioned. In that shipment, you will have 88,725 that will go to Walgreens and CVS to go to congregate care settings, basically in that first phase of the nursing homes. On December 22nd, we have confirmation of 201,000 from Moderna. That will go to hospitals. 98 hospitals have been signed up, 108 health departments. Hospitals will obviously work at vaccinating those who are dealing with COVID patients. Health departments will distribute this to people like EMS. They will vaccinate people who are EMS, home health care workers, for example. And those, there will be more examples, but those will go to, as I said, to hospitals and health departments. On that same day, we have a tentative number for Pfizer that we're seeking some confirmation on, but that number is 123,000. That number is 123,000 on December 22nd. Those, will continue to go then through Walgreens and CVS, and those will go directly. They will be vaccinating people in nursing homes and staff.
How many Ohioans need to be vaccinated in order for us to get back to normal, or the new normal as it may be? When do you expect that to happen, and what will you do to ensure we actually get to that point sooner rather than later?
Well, I'm going to let Bruce answer that, but I don't think anybody knows the exact point. This is going to be a gradation. This is going to be a continuum that's going to be occurring. So obviously it's not going to occur in January, February, or March. It's going to be gradual as it moves forward. At some point, some magical point, we don't know that date, we will achieve the herd immunity. And at that point, life will get back to mostly normal. But, we don't want to make the mistake of pulling back, stopping wearing masks or anything else in the first few months. That would just be a horrible, horrible mistake. Well, I want to thank you all very much. And look, it's a happy day to be talking about vaccines. It's a happy day to be worrying about, who's going to get the first one and who's going to get in the first group. And these are decisions that have to be made, but it's good news. And I think we should remember that there's a lot of hope out there now. It's coming. We just got to stay tough, for the next few months and continue to do what we need to do. Knock this thing back as hard as we can, knowing the next few months will be tough. But there is hope out there, and we're starting down that pathway now.